Hello beautiful people and welcome to my channel. If you are not new here, welcome back. My name is Anava and I make faith related content. In today's video, I'm going to be continuing with the series that I started, talking about my experience in my different rotations as a medical doctor. Today's video is going to be based on general surgery. Now, I started with internal medicine that I uploaded a few weeks back. If you haven't watched that one, please go ahead and watch it. I'm going to leave a card up here and I'm going to leave the link in the description bar below. Without wasting much more time, let's get straight into today's video. So just like the previous video, I'm going to start with sharing my experience, both positives and negatives, and then I'm going to go on to give tips that I have for people as they prepare for their general surgery rotation. The first thing that I'm going to talk about in my experience with general surgery is how the department gave me so much clarity on the fact that I am not meant to be a surgeon. And if you watch my previous video about internal medicine, you will see that I actually did say I want to be a physician, and internal medicine kind of just confirmed that I want to go into internal medicine. I want to be a physician. I want to be a practicing internist. But what I learned in surgery is that even if internal medicine wasn't the option, I am not a surgeon. I am just not meant to be a surgeon. And I say this because what I learned being in general surgery is that surgeons have got a specific drive that is matched by no other. I remember someone once gave me advice when I was trying to figure out what I want to do back in medical school, when they were asking us, what would you like to specialize in? And someone once said, for you to know if you want to be a surgeon, you have to be sure that you cannot be anything else. And that is very true. That is what I see with the surgeons that I was working with. Like, they are so driven, and that is the only thing that they can do. If they were not doing surgery, I don't think there's anything that they could do that could satisfy the desire that they have. And it's very beautiful to watch from the outside in, because I'm not in there, but it's very beautiful to watch people so passionate about their job and so driven. So that's the first thing that I wanted to share. In general surgery, you have to be so dedicated to your work and so dedicated to your patients and so dedicated to the hospital. I noticed this again with the surgeons that I was working with, is that they spent majority of their time at the hospital. Like, they were hospital bound. I could be wrong, please don't quote me, but I think surgeons, amongst every other specialty, spend the most hours in the hospital. And that is why when they talk about going into a surgical practice, they always give you advice based on work-life balance. Work is going to take up majority of your life. So if you want to be very family oriented, if you want to be present in your children's life, if you want to really just have that family and life and fun kind of lifestyle, then it's not impossible, but you really have to consider hard when you enter a surgical specialty. So general surgery, you have to be willing to spend a lot of time in the hospital. Another thing that contributes is the unpredictable schedule. Like, in general surgery, nothing is ever just like, today is just this, because it's naturally a very unpredictable department. It could be just a quiet day, and then from nowhere you get like 3 people with intestinal obstruction and 1 person with perforated bowel, and like, there's so many things that could change in an instant. Like, you could be in OPD and it could be a quiet day and you're chilling, and then you just get a call saying there's been a road traffic accident and they're bringing the patients to your hospital, and from nowhere, like, you have to start going. So I think like that's the thing about surgery that I learned. It's that it is a very unpredictable schedule. You could think you're having a quiet night, and then from nowhere, like, all these people come, all these emergencies come, and it's like last minute. So yeah, it's a very unpredictable schedule. Even with the surgeons, when they'll go home and then you have an emergency, you have someone who's come with perforated bowel, like I said, the surgeon has to come back and do the surgery right there and then, otherwise it could be catastrophic for the patient. So yeah, it's very unpredictable. You constantly have to be on your toes when you're on call. You definitely cannot be too far, because you will come back in an instant. One of the things that you have to get used to when you are working in general surgery is that you will work with so many bodily fluids, and you should become accustomed to so many body smells. Like, guys, this is one of the things that put me off about surgery, the wounds. Like, there are so many wounds. Okay, first of all, obviously, when you go to surgery, you are forming a wound. It's an intentional wound. That one is fine. If that wound gets infected, it becomes bad. If someone has an abscess, if someone has foot gangrene, if someone just has any other wound, like, dealing with the wounds, guys, you have to be used. Like, you're constantly draining pus from people's bodies. You're working with the bowels, like you do DREs. For those that do not know, that's a digital rectal examination where you stick your finger up somewhere. Just get used to bodily fluids, get used to bodily smells. Like, not every patient that you see will be physically clean. Some of them have got bad hygiene. Yeah, like I said, I'm not a surgeon and I don't like wounds, but for the sake of my rotation, I really had to like overcome that and just work with them, guys. Just drain that pus and keep it moving. Oh my gosh. Anyway, if you're a surgeon, I'm sure that's going to excite you. I remember like one surgeon once told me, like, you'll get to the point where you get used to it, where like you're working with a wound and you can be snacking at the same time. And I was like, snacking? I can't even eat like an hour after I've touched the nasty wound. Like, I have to recover. But I guess like for a surgeon, it's nothing, you know. If you're used to it, you're used to it. That's how you know like you're called to the specialty, I guess. I don't know. Back to positives. One thing that I did like about surgery is that you get immediate gratification. Meaning, if you see your patient now, you see what's wrong with them now, you fix it now, and the patient is okay afterwards. Whereas in other departments, maybe you'd have to treat them for some time before they get better. In contrast, in internal medicine, you'd have to treat them with medication for maybe some days, and then afterwards they'll get better. Sometimes you have to treat them with medication for the rest of their life. While in surgery, like, you get the immediate gratification, the person is healed, patient is well, and then they go home and they'll continue the rest of their life like properly most of the time. So yeah, that is a good thing about surgery. You get immediate gratification. But all in all, my surgery rotation was really great. I enjoyed, I can't even lie. I had the best seniors. They were awesome. Like, my seniors are awesome in surgery, so they made the department worthwhile. And like I said, just their passion, their drive kind of like influences you to also want to do more and just really act and do the best for the patient. So yeah, surgery, general surgery, it was great. Not my specialty, but I thoroughly enjoyed it. Now I'm going to go on and give you guys some tips if you are preparing for a general surgery rotation. In total, there are about 7 tips. The first one being, know your anatomy. Of course, the basis of surgery is anatomy. Like, you need to know what you are cutting, you need to know what is there, what is behind, what is next to it, what is above it. Like, know your anatomy. Like, even when you make a diagnosis, a good surgeon is going to be so specific on the diagnosis that you make. I had a patient that had a hypothenar abscess right on the hand, and the diagnosis said hand abscess, and I was working with a consultant at that time, and he was so specific. He stressed on this, like, you need to be able to specify, because even if I don't see the patient, from your notes and the way you describe the anatomy, I need to know exactly. I need to get a clinical picture of what is wrong with that patient. So if you say a left hand hypothenar abscess measuring 5 centimeters, like, I need to know the details of that specific thing. So yeah, know your anatomy, guys. Number 2, learn your first aid. This should have actually been number 1 and then anatomy number 2. But anyway, learn your first aid, especially if you're going to be in OPD. Surgery, you get like emergency people, you get the road traffic accident victims, you get people that have been severely beaten, you get like so many different cases, and you need to know your first aid. You need to know your ABCs. You need to know how to evaluate a patient when they just step in and how to resuscitate immediately. Like, don't go to OPD when you do not know how to save someone's life if they are critically ill, because majority of the time you're the first encounter that they have when they just reach the hospital. Number 3, sharpen your response time. And what I mean by that is be able to cannulate, catheterize, suture, insert an NGT, like just be able to do that in the quickest time possible. So of course that's a skill that you have to master. The first time that you cannulate, you won't be able to do it in like 5 seconds. You'll take a little bit more time, and that's fine. But then just start to sharpen your response time on stable patients. Try and do it as fast as you can, so that when you do get an acutely ill patient that needs fluids running in like 2 seconds, you're able to just cannulate and put the fluids in immediately. You do not want to be struggling with a cannula when a patient is in shock. You don't want to be figuring out how to suture a wound when someone is actively bleeding from a laceration. Learn how to do procedures in the shortest time possible. Number 4, get comfortable with traumas, with wounds, with smells. I spoke about this priorly. Like surgery, you have so many wounds. Some of them are not pleasing to look at. You have so many smells. This is a little bit graphic, but if you have a foot that is literally rotten and there are maggots in it and someone comes to the hospital, you have to take care of that, so you have to get comfortable around that. You have to get comfortable around people who are completely burnt. Early in my surgical rotation, I had a man who was burnt. He was set on fire by a mob, and then someone was able to get him and bring him to the hospital, and he was like literally burnt everywhere. And my first instinct was like I froze for a second, and then like I activated myself and started acting. But you have to be comfortable with like seeing tissue that is completely burnt off a person, and of course that will have a specific smell. So just get comfortable with trauma. Like just know what to do for your patient in that moment. That doesn't come natural to everyone. It didn't come natural to me, but it's something that I had to pick up along the way. Number 5, similar to number 4, learn how to clean your wounds. If you want your patients to heal faster, especially if the wound is infected, do it yourself. Don't rely on students, don't rely on nurses, don't rely on other medical personnel to clean the wound for you. Just clean it yourself. That's something that I learned in surgery. Just clean the wound, treat your patient, and help them get better. Learn how to clean wounds, whether you are cleaning with natural remedies, whether you are cleaning with hydrogen peroxide, whether you are cleaning with saline or just Savlon, whatever it is that you are using, just learn how to clean wounds effectively. Number 6, practice your suturing. You don't have to do this in the hospital all the time. You can do this at home. I know they have the little suturing sets that they sell. You can get that, I think, in chemists. Get a suturing set and just practice how to suture. Get like an orange or a banana and practice your suturing. You can't learn how to suture on a patient, but you can improve your suturing on a patient. So practice your suturing as much as you can. Practice the different types of suturing, figure of 8. Make sure you can do everything and you can apply it as needed. The last tip that I have is stock up on your scrubs and your Crocs. You will need as many scrubs as possible. If you are like me, I wear scrubs to work every day. I don't like to wear my personal clothes. I think it's just too much stress to think of an outfit every day. So I prefer wearing scrubs to work. And so if you're going to wear scrubs to work, you have to have a separate set of scrubs for the OR that you're going to use when you go to theater. And so you have to stock up on scrubs like crazy before. Even if you do wear clothes, you still need a separate set of scrubs to wear to the OR, unless you're going to constantly wear clean it, so that you can wear the same one again and again. But it's just easier to have a whole set of scrubs that you can wear at different times. Alright guys, so that is the end of the video. I hope you did enjoy it. That is a summary of my general surgery experience. If you have been in general surgery and you have any other tips, or you want to share any other experience that you had, please go ahead and comment it down in the comment section below. If you did enjoy this video, please go ahead and give it a thumbs up. Follow me on my social media. My Instagram is anava.exo and I interact with a lot of you there. So please go ahead and give me a follow and message me over there. I do respond to messages that I receive. Thank you so much for watching. Bye.